I'm Dr. Tosin Odunsi, and I'm a board-certified OBGYN. PCOS is one of the common conditions that I treat. In fact, I see PCOS every single week in my clinic. The goal of this video is to talk through the medical management of PCOS and give you some options if you are having issues with PCOS. So let's make sure you understand the medication options for PCOS and how to best manage it. When patients come to me with PCOS, I want to make sure I'm taking care of the big scary things. In PCOS, because you're having these periods at random times, the endometrial lining, meaning that lining of the uterus, it becomes disordered, and that increases the risk of endometrial cancer. Now, one of the medications that we use to decrease that risk is birth control pills. The next thing that PCOS increases your risk for is insulin resistance. So when I'm doing blood work, I want to make sure that you're not diabetic and you're not insulin resistant. If that blood work comes back positive for those things, I may start a patient on metformin, which helps with that insulin resistance. The next would be some of the aesthetic things, so excess hair growth and acne. And not only do the birth control pills help with those things, but also I may prescribe a medication called spironolactone. And spironolactone, it helps to decrease the acne and the hair growth. One of the things I have to tell patients about is if they are trying to get pregnant, we do not recommend spironolactone because it can cause feminization of male fetuses. So that's something to keep in mind. These are different options for you, and I want you to make sure that you talk to your physician about them and see which one works best for you. So just to recap, the birth control pills is going to help you have regular periods. The metformin is going to help if you have insulin resistance or diabetes. And then the spironolactone is to help with the acne or the excess hair growth that you might have. We've gone through several medications that are addressing different issues that you might have with PCOS. If you're having these issues, make sure to talk to your OBGYN about them so that you can have the best quality of life. If you like this information and if you like talking about women's health, make sure to subscribe to this channel.